Welcome to topic 3 of managing human resource for health. In this session, we are going to look at job analysis in healthcare. So this topic is very important for you, the human resource or the hospital administrators, because the people you're going to be managing are people who have not studied the same course with you. For example, maybe you may need to recruit a medical doctor, but for you, you've never studied medicine in the university. So this presentation will help you a lot to make sure that you get the right person for the job. So in some books, it is called work analysis. So when you come across job analysis or work analysis, it means the same thing. So by the end of this presentation, I expect you to analyze healthcare job descriptions and identify the required skills, knowledge, and abilities. Explain how job analysis can inform job design and training programs. Discuss the ethical considerations involved in job analysis, such as fairness, bias, and the privacy. And lastly, develop a plan for using job analysis to address a specific challenge or opportunity in healthcare organization. So having looked at the learning outcome, now let us focus on the definition of job analysis or work analysis. So we're going to define job analysis in terms of systematic process, in terms of job content and job context, and lastly, in terms of the purpose. So beginning with the systematic process, we are saying that it's basically about a structured data-driven approach to gather information about a specific job. For example, you want to recruit a lab technician, but you do not have any knowledge. You don't know what the job of lab technician is, how it is supposed to be done, etc. So it is through the job analysis. You need to analyze it to make sure that you get the information required to do the job in terms of what the person is supposed to be doing and how it is supposed to be done. So it's basically about getting information about the work of lab technician if you're talking about the process. So we can also define job analysis as job content and context. So under content and context, we're talking about now the skills, the tasks, and the responsibility or authority associated with the job. The potential candidate you're looking for, is he or her having the required skills needed for the job? Is she having the knowledge? Okay. Is she having the experience required for the job, etc. It's basically about the responsibility the potential candidate is supposed to be doing in regards to the job you are trying to advertise. Then lastly, we can divide it in terms of purpose. So in terms of purpose, we are talking about the description of job, okay, or what you can call job description. Job description is basically the daily tasks, the daily tasks doctors, nurses, and midwives are doing in the hospital. So we are conducting the job analysis or work analysis to make sure that we develop the job description. Otherwise, without analyzing the job, it becomes very difficult for you as the human resource in the hospital to develop a job description for a lab technician. So that is how job analysis helps you as the human resource manager or admin in the hospital setting to make sure that you develop a effective job description which can help attract a potential candidate for the position you are trying to advertise for. So basically, these are some of the definitions of job analysis or what you can call work analysis. So having looked at the definitions, now let us focus on the step of job analysis process. Number one step is the planning and preparation. So under planning and preparation, of course, the job analyst, if not the human resource manager, uh, is trying to determine which job to analyze. In the hospital setting, we have very many jobs. You have the nurse, the job of the midwives, the lab technicians, even a medical doctor sometimes. Okay, you need to analyze the job. You first have to identify the job you are supposed to analyze. This is very rare nowadays. People don't analyze job. Okay. You are the human resource, they need an accountant, you just advertise. You are the human resource, they need the logistic officer, you just advertise. They need a medical doctor, just advertise without conducting a job analysis. It's very important. You need to really conduct the job analysis. Even if you know what the job is all about, you might miss on some information. It's better you analyze the job. So this is about the preparation and planning. You need to determine which job to analyze and even the person who is going to be analyzing the job and what kind of methods are you going to use in analyzing the job. So that is stage number one. Then process number two, or stage number two is the information gathering. So at this point, you've already identified the job you want to analyze. You also have the job analyst. Okay. You also have maybe the resources required for the job analysis exercise. You also have the methods already in mind, the one you're going to use for collecting the data. It could be an interview, it could be observations, it could be through questionnaires, etc. So that's about the information gathering as our step number two in the process of job analysis or work analysis. The next step, which is now step number three, is the data analysis and interpretation. Okay. After you've gathered the information about the task, we are analyzing the work of lab technician in the hospital. Okay. You have already gathered the information, whether through questionnaires, whether through interview or through observations. Now you are interpreting the data. This will help you to identify exactly what is required in order to do the job of lab technician. Okay, what kind of skills are you looking for? It will help you during the data analysis stage. Then the last stage in the job analysis of work analysis is the job description. The job description is basically the daily tasks or activity the doctor, the nurse, and midwives, etc., are doing in the hospital. That is where you can now develop a complete job description, which can help you now to advertise for the position. Remember, a job description is also an element for advertising. There's no way you can have an advert without a clear job description. So these are some of the important steps of conducting job or work analysis as admin or human resource in the hospital you need to know. So having looked at the analysis step, now the next thing we want to look at is the job analysis method. Number one is the observation. By observation methods, the job analyst basically sit down and see what the current job holder is doing. In our case, we are analyzing the job of lab technician. Okay, the job analyst just sit down and then see what a lab technician is doing as he writes down his findings. Number two is interviews. With the interviews, the job analyst can have the interview with the incumbents. With the incumbents, we mean the current person who is doing the job, and that is the lab technician. Okay, the analyst can decide to interview the job technician on what he or she is doing. Then also, the job analyst may decide to interview the supervisors, okay, of the lab technician, and also some expert relative to the field and maybe even former employee, someone who has ever worked as a job, as a lab technician. So the job analyst can interview such kind of people in order to get the information about the work of a lab technician. Then the last method of job analysis is the questionnaires. This is where the self-administered questionnaire is given to either the incumbent job holder or to the former job holder or to the supervisors or to the job analyst. Okay, they will fill the form and then bring it back to the job analyst for analysis. So these are the major methods of conducting job analysis in an organization. Otherwise, people sometimes also refer to internet, okay, to get the job duties, skills, etc. The internet can also help you to do that, but it's very important you use the three methods which I've just mentioned. So having looked at the methods of job analysis, now let us focus on what job evaluation is. So a job evaluation, we're going to define it in terms of also systematic comparison, in terms of compensation and fairness, and lastly, in terms of external competitiveness. So let us begin with the systematic comparison. Job evaluation is basically comparing two or three jobs within the organization to see which one is worth in terms of scope, in terms of responsibility, or in terms of experience and academic qualifications required. Okay. For example, a medical doctor, the job of a medical doctor is evaluated or ranked higher compared to the work of the uh, lab technician or a work of the midwife in the hospital setting. So that's what you call job evaluation. By default, we know that a doctor is supposed to be earning more than the midwife by default. But you need to also evaluate so that you get yourself to know why the doctor is earning more than the midwife, why the doctor's job is evaluated or ranked higher compared to the midwives. So that's about comparison. Then the next element or the next definition of job evaluation is compensation and fairness. So it helps to determine compensation based on the level of experience, okay, based on the level of academic qualifications, and based on the level of any technical competencies required to complete the task. For example, a doctor is supposed to earn higher than the lab technician or the midwife. Okay, that's how job evaluation helps you to determine that. So in this point, the nurse will not complain that why the doctor is being paid highly, okay? Because the job evaluation is already done, and then the finding is that a doctor must be having a higher uh, academic qualification compared to the midwife. The midwife can be having a diploma, but a doctor maybe is having masters or even a degree, etc. So that is how job evaluation helps in terms of determining compensation. The last point is external competitiveness. So when we talk of external competitiveness, we are talking about benchmarking against the similar role in the external market. The other organizations, the other hospitals, how much are they paying their doctors? How much are they paying their nurses, the midwives, etc.? That's what we call external competitiveness. So through job evaluation, you are able to benchmark. You're able to know how much exactly you're supposed to give to your doctor after benchmarking from external job market. We call it competitiveness because we don't want to underpay our doctors. If you pay your doctor a very small salary, that doctor may end up leaving the organization. Okay, maybe that doctor is having supernatural skills. There are some doctors, they're just naturally excellent. They interact with the patients, they do their job professionally, etc. But if you're underpaying them, of course, chances are high that they may end up leaving the organization just because you have not evaluated their jobs. Okay, so that is how job evaluation helps us as the human resource, as admin in the hospital, to make sure that we give a competitive salary to our employee. Our employee, we are talking here about the medical doctors. Of course, you cannot also ignore other support staff. I keep on saying that they also play a very crucial role in order to make sure that the patients receive the services they deserve. The administrators, the drivers, the cleaners, the ascaris, the cooks, etc. All of them directly or indirectly contribute to the to the recovery process of the patients in the hospital setting. So basically, that's about job evaluation. It's very important for you to evaluate job in the organization. So having looked at that, let us now focus on the benefits of effective job analysis and evaluation. Number one is improved recruitment and selection. After analyzing a job, of course, you're going to have a clear job description, and it becomes very easy for you to attract qualified candidates when the job description is clearly stated. And that job description comes in when you have analyzed the job. There's no way you can have a clear job description if you have not analyzed the job. I've told that do not depend on internet to develop job description because internet sometimes has outdated information. Okay, and they are not, in most cases they are not contextualized. It's very important you conduct your own job analysis to get first-hand information. So by doing that, you're going to get, of course, the right candidate for the job. The next one is the enhanced training and development. Okay. There's no way you can talk of training without analyzing the content of the job. Actually, you can analyze the content of the job, you can analyze the context of the job, even if you already have the person doing the job. That one will help you to design a training program based on the outcome or based on the findings of your analysis. So by doing that, you're going to have a clear training program which will equip the necessary skills you need to give to your doctors, to your nurses, the midwives, etc. So the next important or benefit of effective job analysis and evaluation is performance management and motivation. Performance management becomes easy. When you talk of training, training is actually part of performance management. When we talk of setting clear objectives or clear tasks or targets, it's part of performance management. And this comes through job analysis. There's no way you can set a clear target when you have not analyzed the job. That's how it helps in motivating employees. Otherwise, if the job description is not clearly stated, then there's no way employees are going to be motivated. The employees I'm talking here is the doctors. The employees I'm talking about here is the nurses, the midwives, etc. They will not be motivated because the job description is not clear as a result of not analyzing the job. Okay, so all these contributes a lot to make sure that the employees in the organization remain motivated to perform their duty, so that the patients receive the services they really deserve. Lastly, reduce cost and turnover. Okay. When we talk of the cost, we are talking about cost related to personnel management, cost related to the human resource. What are the costs? The cost can be in terms of recruitment. Recruitment comes with a lot of expenses. You need to advertise, time consuming, and also we have errors during the recruitment process. We have basically two errors committed by the recruiters. One is the what you can call selection error. Selection error happens when you end up giving the job to the wrong person after impressing you during the interview. That's error number one. Then error number two is the omission error. Omission error is now the opposite of selection error. With omission error, we are talking about you letting go of the most competent candidate just because he or she did not do well during the interview. So these are some of the errors we commit in an organization. There's no way you can avoid that. You only do is to make sure that you minimize it. Alternatively, you can have external experts to conduct the recruitment exercise. Actually, that's why some organizations they are resorting in what you call the internal recruitment process. If they need a manager, they just promote one of their employees to that person because they are trying to avoid the errors I've just talked about. So that is how job analysis help you to avoid such errors because you clearly know what the job is all about. By the time you're going for an interview, you actually know how you're going to structure your interview questions to make sure that you get the right candidate. Then reducing turnover. Turnover is basically the rate at which people are leaving the organization. They are coming today, next year, they're leaving the organization because of maybe uh, issues related to performance, issues related to lack of motivation, etc. So job analysis helps you a lot. By the time you develop the job description, it means the potential candidate who is going to apply for that job actually knows what is expected of him or her clearly. Okay, so if you have a job description effectively developed, of course, you will not have problem with the employee turnover. But if you don't have a clear job description, the employee comes in, then they find it very difficult. They don't know what they're supposed to be doing. Then what will they be doing in the organization if the job description is not clear? Okay, they'll end up leaving the organization, leading to high labor turnover. So these are some of the benefits of having a clear job analysis and evaluation in an organization. So having looked at the benefits, now let us focus on the job design. So job analysis, job evaluation, job designs work actually hand in hand. So with the job analysis, with the job design is basically a way in which the organization wants the doctors to perform their work. It is a way in which the organization wants the midwives, the nurses, the lab technician to do their work. So in this presentation, they're saying that it is about the structuring work, okay, in a way that the task, the responsibility, and the authority associated with the particular job is clearly mentioned. So in the job description, you know whom, in the job design, you know whom are you going to report to. You know there's your supervisors, you know the person even you're going to be supervising, etc. So it's basically about a structuring the work. And this one also happens after you conducting job analysis. The key here is the job analysis. There's no way you can evaluate the job. There's no way you can develop job description. There's no way you can design a job without conducting job analysis. So the next one is optimizing performance and satisfaction is still under job design. Job designing can make someone satisfied with his or her job and then the person will be performing. Why? Because the way you want the work to be done is actually the easiest, depending on what the employee wants or what they perceive to be the best. So it aims to find the best way to organize work to enhance both individual and organizational performance as well as employee satisfaction. So the element of dissatisfaction comes in when the employee doesn't know what to do or how to do it. Okay. When the job is becoming very difficult to do, of course, there is no element of satisfaction. What happens when the employees are not satisfied? There will be an attempt to resign. Okay. So these are some of the definitions of job design in relation to the healthcare setting. So what are the key elements of job design? Number one is the skill variety. Okay. So the employees, the doctors, the nurses, the midwives, they need to have a variety of skills. For example, they need to have a skill on how to operate computers. The doctors will not only be focusing on operation or focusing on prescription of medicine, but they also need to have the skill of operating the computers and some other medical equipments, the X-ray, etc. So that's what we mean by variety of skills as a key component or element of job design. So the next element of job design is task identity. So when talk of task identity, we are meaning that from the day the doctor is starting their work, from the day the work is ending, the tasks will be identical. Okay. You don't need to mix tasks. The person will start with a different task. Then is in the middle there, you change the task. Then at the end, the task is also changed. That is not a good job design. So we need to have that identity. From day one up to day last, there must be identical task the person is doing. That will help the person motivated. That will help the person to be satisfied with the job he's doing. The next one is now the autonomy. When talk of autonomy, we are talking about giving power to the employees to make a decision over the work. Don't let the employee come into you all the time to ask you on what to do next. No. As you're designing the job, you need to give them the authority. You need to give the doctors, the nurses, the authority to make critical decisions without necessarily conducting the administration. The last one now is the feedback. You need to appraise the employee's performance. You need to give feedback to the doctors, to the midwives about uh, their performance, the work itself. If everything is not moving smoothly, then it has to be communicated to them so that they know where the problem is. And also for you as the admin, you need to redesign the job where you feel that the employees are not doing enough to the expectation. So these are some of the key elements of job design you need to know as human resource managers in the hospital. So what is the benefit of effective job design? Number one is increased satisfaction. I've been over explaining about satisfaction. If the job is designed in a manner that suits the employee, they are going to be satisfied. But if the job is not designed to the expectation, it's giving them hard time. Of course, they will not be satisfied with the job. And then what happens is that the performance will go down, the morale, etc., will all disappear, and then the employee will end up resigning from the work. So the benefit is that it increases the job satisfaction. Then number two is it enhances productivity and the performance. So when the job is designed in a way that the employees are enjoying it, it means that their performance level is going to go high. They're going to be very productive whenever they come to work, etc. So when they do that, of course, the hospital is the one benefiting at the end of the day because the people or the client we are handling here are the patients, the sick people. So there's going to be high recovery rates. There's going to be reduction in death of rate recorded in the hospital, etc. Just because the job is designed in a way that suit the employees, and then they are going to be very productive in terms of executing their daily duties. Lastly, it reduced turnover and absenteeism. Okay, we have been explaining turnover, employee leaving in the organization, but now let us focus on absenteeism. How does job design help to reduce absenteeism? Absenteeism happens when someone doesn't want to come to work because the work is giving him or her hard time. Okay, he doesn't know how to do the job. He will not be coming to work all the time. But if the employee, the doctor really, the nurse knows how to do the job very well, then there's no point of him or her uh, not coming to work. So that is how job design approach someone always to come to work every day and on time. So these are some of the benefits of having effective job design in the hospital. So having looked at the benefit, now let us focus on the contemporary issues in job design. What are the contemporary issues in job design? Number one is we have the rise of remote work. Okay. The rise of remote work, we're talking about someone not necessarily working from the office or from the field. The person might decide to work from home, online. However, with doctors, it becomes very difficult to work online because the patients are in the hospital. It depends on the job the doctor is doing. Maybe you can talk about consultation, but again, with consultation, the doctor has to be physically seeing the patient, taking temperature, etc. Okay, but administrator can decide to work from home. That's under remote work. But for a doctor, it becomes a little bit tricky. We don't have the technology yet to allow doctors work from home, but it can always be done. The next one is the flexible work arrangements. Okay. With a flexible work arrangements, we mean that the employee can decide to work maybe from evening hours, late up to night, maybe to 10 p.m., then they go home. Doesn't mean employee must be working from the normal working hours, 8 to 4 or 5:30. No, that arrangement is always there. Someone can decide to work as a part-timer, okay, not necessarily a full-timer. Someone can decide to work only on weekends. So that's what you call a flexible work arrangement as some of the contemporary issues in job designing. So as admin, when you're designing job, you need to also think about the points I've just mentioned. People trying to work from home or remotely, people who are trying to work as a part-timer, or who are trying to work only maybe on weekend and evening hours, etc. So these are some of the contemporary issues you need to get yourself familiar with. Don't be surprised if you're discussing contract with someone, then the person tells you that for me, I want to work from home. For me, I want to work from this time to this time. Don't be surprised. You also need to consider that. The next thing is now the job redesign. You have been looking at job designing. So the next one now is the job redesigning. So with the job redesigning, we're talking about altering the task responsibility which is already in place and also the authority. Okay. This comes in when the job you designed initially is not producing the outcome you want. Maybe it is complicated for the employees to do them. You need to redesign them so that it can suit them. So it aims to create a better fit between the job and then the employee, enhancing both individual performance and the overall job satisfaction. So as a manager, as admin in the hospital, when you discover that the employees are facing problem with the way you design the job, you need to redesign it. Doesn't mean you have to be quarreling or punishing them by suspending them or even terminating their contract. That's not right. As a manager, the right thing to do is you need to redesign the job. But if the employee continue to complain, maybe that's when you decide that they are not competent enough for the job. So at this point, you may have no choice, maybe to face them off. But otherwise, you need to always redesign uh, the job. So that's about job redesigning. So having looked at the definition now, let us focus on the types of job redesign. One is a job enlargement. When we talk of job enlargement, we're basically talking about expanding the scope of the current job by including more responsibility in the tasks the doctor, the nurse, the midwives are doing in the organization. That's about job enlargement. Just add more tasks to them or responsibility to them. The next type of job redesign is the job enrichment. Job enrichment, we are talking about giving total control, okay, or autonomy to the employees. Let them feel the ownership of the task they're doing. That's what you call job enrichment. Where the employee feels that they have control over the job, they have the authority to alter it themselves without necessarily coming to the organization or to the admin. Okay. The next one now is the job rotation as a means of designing the job. The job rotation is basically taking employees to work in different uh, sections, but within the same department. Okay. In the setting of the hospital, you can decide to put the doctor only prescribing the medicine, or you can put the doctor now only to be doing consultation when the patients are brought to the facility. They do the consultation, etc. That's how you do job rotation. So it helps a lot in terms of designing the job. Also, it helps a lot in terms of motivating employees, because some employees they don't want to do the same thing over and over again. It becomes too monotonous to them. The last type of job redesigning is the job sharing. Okay, with job sharing, you find two, three doctors doing the same task or the same job. Okay, for example, one doctor can work from morning up to midday. Another doctor comes from midday up to evening. Another doctor comes in from evening till late night. So that's how you share the job. Another element is that they work as a team. Okay, someone is doing the consultation with the patients, another one is doing the prescription, etc. That's how we share the job in order to make sure that we redesign it to suit the competency of the doctors, the nurses we are having in the hospital. So having looked at that, now let us focus on the specialization in healthcare setting. So what is the specialization? Is basically expert within a specific field or division of labor. In the hospital setting, we have cardiologists, we have the orthopedics, the neurology, and then pediatrics, etc. So these are some of the specializations we have in the hospital. It doesn't mean all doctors can do this one. We have specific doctors who only focus on the cardiological issues, orthopedics, etc. We even have others who are basically experts in dentist. We have the dentist, etc. Okay, that's what we call a specialization in the healthcare. So why is it important? Number one is a personalized treatment plans. Okay, the specialization allows healthcare providers to tailor treatment plans according to individual patient needs. If you have a patients who, I mean, if you have some patients who are brought in the facility, they're basically having issues to do with the reproductive health, things to do with the maternal issues. The best doctor to meet them is the gynecologist. That's what we call specialization. At this point, you don't need to refer a maternal or someone who has come for reproductive issues to visit orthopedic doctor. No, or dentist. It doesn't work like that. Okay, that's what you mean by personalized treatment. Okay, someone comes with the tooth issues, don't take the person to the gynecologist. The dentist is there to work on the toothache or something to do with the tooth. Okay, that is the importance number one. Then number two is expertise minimizes errors. That's another importance. A gynecologist is specialized in treating diseases in female, okay, or female health issues, women. So they minimize errors. they will not be doing a lot of errors because they have been trained to handle such cases from the university until the day they graduate. Okay. The error will only come in if you bring someone who's having maybe tooth problem to come and see the gynecologist. The gynecologist might not prescribe the right medicine, and this will lead to errors. So that's what we mean by expertise minimize errors as part of specialization in healthcare. And then lastly, we have comprehensive understanding. So when the patients are brought to the facility, the right doctor has a very good understanding of the whole process. Okay, that means they will provide holistic treatment program to make sure that the patients recover from their sickness. Otherwise, if you don't have the specialization in place, it becomes difficult. The other person might having just a slight information about the disease, but the person who is specialized in that field will have a comprehensive understanding of the disease, and then he or she will be able to develop a plan which can help in treating such sicknesses. So that's about a specialization in the healthcare setting. So the next thing you need to know now is the job empowerment. Job empowerment. In some books, it is called employee empowerment. It's very important as a human resource in the hospital. Make sure that you always empower your doctors. So it's only about creating environment that employees feel that they have to make a decision. They have to contribute to the organization, etc. So if you give them the environment which allows them to make a decision, which allows them to share their views, their ideas, that's what you call job empowerment or employee empowerment. It's an element of motivation and employee engagement. For you, the human resource, the administrators of the hospital, you might not be having clear information on some diseases. So allowing these doctors in decision making, allowing these doctors to have control sometimes is very important uh, when we talk about the recovery of the patients, because they are the people who are being trained to handle such cases. But for you, you are basically administrative in nature. So your work is administrative in nature. So allow them to make some decisions also on behalf of the organization when it comes to medical issues. So the goal is to foster a sense of ownership, autonomy, and satisfaction among employees, leading to increased productivity and innovation. Like I've told you, if you give someone that ownership, authority, and engagement, the person is going to feel motivated. And what happens is that his level of productivity will go high. And what happens is that the persons will be receiving the services they deserve. And at the end of the day, the organization will benefit big from the commitment of such employees. So having looked at that, let us now look at the key principles of employee or job empowerment. Number one is a clear communication. So you need to clearly communicate to the employees the expectations and then the performance metric which you will be using to measure their performance in a very transparent manner. Okay, don't communicate to people differently. If it's about the performance in an organization, it should be the same to all the employees. So communication has to be very clear and transparent. The next one is autonomy and decision making. So you need to give the employees chance to make a decision, especially the doctors. Okay. Like I've told you, you may not be having some of the ideas concerning to the sicknesses you are trying to treat. It's only the doctors who can decide in terms of referral, in terms of altering the prescription, etc. So allow them to make a decision is one of the key principles of job empowerment. Then lastly is the skill development. Okay, so you need to develop the employees by giving them the training so that they become a resourceful assets in the organization, and then also you can also promote them based on their performance, etc. All this is what we call employee empowerment principle. So lastly, let us look at implementation strategies. How do you implement work empowerment or employee empowerment in the hospital. One is the leadership support. Of course, the leadership support, we're talking about you, the administrators. You need to support these doctors. You need to support these nurses in decision making. Whenever they have suggested something is stable, they will not always oppose them because they might be having a good idea which can help the organization run smoothly. Then the last one now is the employee involvement in decision making is also one of the strategy you need to use for implementing that. Seek their input on any subject you want to discuss about the organization, etc. So that's about implementation strategies as far as employee empowerment, work empowerment is concerned. So with that, we have come to the end of this presentation. I expect you to have more research so that you can have a broader view on how job analysis or work analysis influences the organizational performance.